Hello everyone, I am Dr. Prateek Joshi. Today we have a case of a young individual with left knee posterior horn medial meniscus complex tear. As you can see on the diagnostic arthroscopy, the anterior cruciate ligament is completely normal. And after that we are going to enter the medial compartment. While my assistant extend the knee and gives the valgus force, I am going to enter the medial compartment, and that is the medial meniscus. The space is tight, so in order to assess the tear as well as to repair any tear, we need to do MCL pie crusting, and this is the view after the MCL pie crusting. As you can see, I am viewing from the anterolateral portal, and I have inserted arthroscopic probe from the anteromedial portal, and you can see there is a longitudinal tear involving white zone, which is not going to respond to any repair because it is avascular zone. So we are going to use arthroscopic punch to trim that white zone tear involving the posterior of the medial meniscus. I am going to be conservative in trimming the meniscus. I want to save as much of the meniscus as possible because he is a young individual and we don't want to sacrifice too much of the meniscus. So now I am viewing from the anteromedial portal, and I have inserted the arthroscopic punch from the anterolateral portal, and I am going to trim another flap of the posterior horn medial meniscus tear, which is coming in the way, and we are going to excise this because again this doesn't look like it's going to heal because of lack of vascularity. You can see that I have inserted the arthroscopic punch in upside down manner because that is the only way I can engage the torn portion of the medial meniscus posterior horn. Dealing with meniscus tear requires good triangulation skills while using arthroscope, and it is many times quite challenging, and the challenge is also not to damage any normal cartilage in the femur and the tibia. So as you can see, I have removed the portion of the posterior of the medial meniscus, which I am going to excise with arthroscopic grabber. So now we are going to start arthroscopic meniscus repair procedure. I anticipate that we might need around 2 to 3 all inside suture devices to repair this complex tear of the posterior of the medial meniscus. So I am using arthroscopic shaver to roughen the torn edges of the medial meniscus, and then I am going to insert cannula, and I am going to insert all inside device from the anterolateral portal, and I am going to engage the inferior capsule and deploy first implant. After that I am going to engage the meniscus tissue superiorly in order to make a vertical mattress stitch configuration. So as you can see, I am piercing the superior portion of the meniscus, and then I am going to pull out the device and then pull the thread in order to tighten the sliding locking knot. So this completes our first deployment of the vertical mattress all inside suture, and the thread is going to be cut now. After this I am going to change my portals and insert the all inside device from the anteromedial portal to address the lateral most portion of the posterior horn of the medial meniscus. So I am going to deploy first implant through the substance of the posterior horn of the medial meniscus, and as you can see, I have deployed the first implant, and now I am going to maneuver my all inside device in such a way that I engage superior portion of the posterior horn of the medial meniscus. And now I am going to deploy the second implant. The second implant is deployed, and now I am going to pull the thread to tighten the knot. So this completes the second all inside device fixation of the posterior of the medial meniscus. This is in the most lateral portion of the posterior of the medial meniscus. I am going to cut the thread now, and then again I am going to change the portal and insert another all inside device, which is going to address the anterior most portion of the posterior horn tear. And here you can see I am inserting the all inside device from the anterolateral portal, and I am going as anterior as possible to engage the anterior most portion of the tear of the posterior horn of the medial meniscus. I have deployed first implant inferiorly, and now I am going to deploy another implant superiorly. So this is again going to create vertical mattress suture configuration, and as you can see, I have deployed the second implant, and now I'm going to pull the all inside suture device and tighten the knot. So you can see that the knot is well placed. The meniscus appears to be quite nicely reduced, and I have cut the thread, and this is the final picture after using three all inside devices. Now the meniscus repair looks to be stable and robust. Another flap of the posterior horn of the medial meniscus is there, which I am going to trim with arthroscopic punch and arthroscopic shaver. We should always try to preserve as much of the meniscus as possible in young individual, because that is going to have an impact over arthritis development in future in that particular knee joint. So we should try to be as conservative as possible. Meniscus is not like appendix, it is not a vestigial portion. It has a big role in stability of the knee joint as well as to prevent excessive stresses in the knee joint. So this is the final picture after meniscus repair and partial debridement. We have used three all inside implants. You can see the repair is quite robust and strong, and we anticipate good recovery in this patient. Thanks for watching this video. Do like and share the video. Subscribe to the channel. If you have any queries, you can ask in the comment section.